Our topic is about access to healthcare. According to Alliance Care, in the Philippines, it is still an issue because Philippines still struggle with unequal access to medical care, especially in public healthcare, faces some limitations.
2020, only 50% of Filipinos could access primarily healthcare within the government's 30-minute standard. So public health spending in the Philippines remains one of the lowest in the ASEAN region. And most of these Filipinos are from the low-income and rural areas.
So we're going to tackle it in 5 different main ideas. The first main idea is about availability. According to Philanthropy Asia Alliance, the local barangay health centers struggle with lack of resources like inadequate supply of equipment and medicines. This shortage makes it difficult for them to provide essential healthcare services to the community. As a result, many patients have to go elsewhere for treatment, often at a higher cost. The situation is further complicated by a shortage of trained healthcare professionals, leaving residents without adequate care. These challenges lead to a cycle of poor health outcomes, especially for vulnerable populations. It is essential to address these issues to improve healthcare access and equity in the region. The second main idea is about limited insurance coverage, connecting in high out-of-pocket costs. Still, health members still pay out-of-pockets in spite of universal healthcare, according to a group of researchers from the Philippine Institute for Development Studies. According to Lagman 2023, elderly, women, rural, and poor Filipinos are more likely to spend more due to national health insurance coverage being limited to 40% of total hospital costs. PhilHealth members will have to pay out-of-pocket for 60% of their hospital bills for the foreseeable future, as universal healthcare is not yet placed in the country. This affects inclusivity in the diverse community, especially for the poor, because they may struggle to access necessary healthcare.
The third main idea is the limited access to healthcare in the Philippines, particularly for those in low-income and rural areas. Many Filipinos, especially in low-income and rural areas, struggle to access proper health care due to financial barriers, poor public health funding, and limited infrastructure. Rural residents often face additional challenges like a lack of nearby facilities and transportation issues, making it even harder to get timely medical attention. Without adequate health insurance, many delay or forgo medical care, worsening health disparities and leading to preventable diseases. This affects not only individuals but also the overall well-being of communities.
The fourth main idea is the policy implementation in healthcare system in the Philippines. According to Universal Healthcare, the plan aims to ensure all citizens have access to comprehensive healthcare services, focusing on preventive care, outpatient service, and hospital coverage, and improving the healthcare delivery system. According to World Health Organization, the primary problem is the lack of funds. The amount allotted for healthcare is frequently inefficient, which result in a shortage of supplies, subpar infrastructure, and underfunded initiatives. The World Health Organization stated that the Philippines' health spending is still below recommended levels, which make it more difficult to provide complete care. And also, the shortage of healthcare professionals is another pressing issue. Many areas, especially rural regions, struggle with inefficient numbers of doctors, nurses, and other healthcare workers.
The fifth main idea is healthcare workforce shortages. Another challenge is the shortage of healthcare professionals, which limits access to quality care, especially in underserved areas. Globally and in the Philippines, healthcare worker shortages are critical. Many professionals leave for better opportunities abroad, leaving local systems overwhelmed. With fewer doctors and nurses, patients face long wait times and reduced access to care, especially in rural areas. This shortage not only strains the healthcare systems, but also leads to overworked staff, impacting the quality of care. Without enough professionals, both preventive and urgent care suffer, making it harder to meet the needs of the population. Importance of asserting this issue, addressing the shortage of healthcare workers is crucial for ensuring equitable access to care. Without enough professionals, healthcare systems will continue to struggle, leaving vulnerable populations without the timely and effective treatment they need. By tackling this issue, we can improve overall health outcomes and reduce disparities in care.
Practicing inclusivity in healthcare requires a various approach at both personal and institutional levels. Cultural competencies training enhance healthcare workers' understanding of diverse cultural backgrounds and health needs. Promoting compassionate care, participating in decision-making with marginalized population ensure their needs are met and accessibility is prioritized.